afternoon. Hope everybody's doing well. If I haven't had a chance to meet you yet, I'm David Stockwell. I'm the acting medical center director for most of the month of November here at Pacific Islands Healthcare System. And for those that are on the adjoining islands or in Guam or American Samoa, if you happen to be timing-wise watching the town hall meeting, it's nice to meet you. It's great to be here with you. This is a little bit different town hall meeting than many that you have potentially been to in the past. This is a town hall meeting that Secretary Bob asked each medical center director to go back and to personally deliver to their staff at all of the facilities. And so I'm going to be the stand-in, doing his slideshow, doing the Undersecretary for Health slideshow, and talking a little bit about the VA. The purpose of the town hall meeting is actually because the VA has been receiving lots of negative publicity in the newspapers, on TV, in a lot of the national articles. Even USA Today has a sale report article that they're going to publish imminently that's going to actually show the star levels of each facilities across the country. And the VA has been trying to get out positive news stories about things that are good about the VA, fairly unsuccessfully. In fact, last year, the Secretary said to every director, you must go back and do a press release and invite all the media to come in and do some positive news stories at your VA. And so I gathered some patients that we cured of hepatitis C together. I gathered some folks that had been waiting for sleep studies and had gotten them done, that had been life-changing, some veterans. We got some staff. We had 3 good news stories. We invited all of the newspaper channels, the TV, the newspaper in, and no one showed up. It was kind of disappointing for those veterans. They were ready to share their good news, positive stories, and it wasn't a good news story that was marketable. And so the good news stayed where it was. It didn't get out. And I often hear criticisms as a medical center director, how come, boss, you're not out there doing a better job saying good things about the VA? All we ever hear is negative. And so I'm going to actually shift that a little bit to you all today. You're going to hear some good news things about the VA. In fact, I guarantee you there's no one here in the room that isn't going to learn something new. I can't guarantee that. Dr. Bagby heard the presentations in Washington, so she might not learn anything new. The rest of you are going to learn at least one good news fact about the VA that you didn't know before today. So the challenge is, if the media won't come and film a good news story at the VA, can VA employees, from a grassroots perspective, actually share things with others that they're proud to work for the VA? And so the whole point of today's town hall is for you to leave with, I've learned something new about the VA, and when I'm at that family event or in public or at that party and people find out I work for the VA, what am I going to say? So when they start shaking their head and say, oh, you work for the VA, what are you going to come back with? What are you going to share? And so the idea is there's some positive things to share. Before I get into the slideshow, though, I want to encourage folks, we're on a campaign to try and get everybody vaccinated. Flu season, we want to be at work, we want to keep our patients healthy, we want to make sure that we're not responsible for spreading infection, and so right outside the door, you can get your flu shot. In fact, if you get up in the middle of my presentation and go get your flu shot, get your vaccination, you can. I won't be offended. If you don't want your flu shot for whatever reason, we're also trying to document, did you want it? Did you already get it somewhere else? Do you not want to get your flu shot? And so there's a little form where you can just sign the declination saying, I don't want to get a flu shot. You don't have to say why, but that form is just right outside. So if you haven't done either one, either gotten your shot or declined, you can do that right outside the door. If you're here in Honolulu, if you're at the other locations, find somebody to give you your flu shot. There's somebody there that'll be willing to do that. Stella, you had a comment?
They can't really hear you on the phone, so you can speak into the mic.
They cannot hear me speak into the mic. I will attempt. I have a clicker and a mic, and I move my hands when I talk, so it's going to be challenging, but I will try and do better. So let's talk about some things about why you should be proud to work for the VA. 2014 was sort of the watershed moment for the VA. This was when the story broke at Phoenix about patients waiting a long time to get access to care, about senior leaders hiding secret waiting lists, trying to fudge the numbers so they looked good in their performance measures, but really were struggling to provide timely care to veterans. That happened in May of 2014 is really when the story broke. Since that time, the VA has 14 of its top 17 leadership positions are new. So many times you'll hear in the news, the bureaucracy of the VA, no change, it's the same old machine, moving forward, resisting change. But the reality is there's been a significant turnover in senior leadership at the VA since 2014. Some of the things that have happened that are different since that time, the Secretary of the VA now has a My VA Advisory Committee. It's actually a group of patients, veterans, that have direct access to the Secretary of the VA. And they're from a variety of different locations. They get their services not just in healthcare, but at veterans benefits at the National Cemetery. Although the group that's getting their services from the cemetery, I'm not sure how actively they're participating in the My VA Advisory Committee group. But for the last year and a half, direct access. This is actually a motion that the VA wants to encourage at its local level as well, that we create direct access for our patients to be able to talk with us. Excuse me. The idea that the VA runs itself and that we help veterans when they come to us, and sometimes they're kind of a nuisance or a problem because they form a long line or they keep calling on the phone, and we have to take care of them when we have such other important work to do, is really a fallacy we need to leave behind. The long line and queue, they're the reason we're here. We serve those who served, not the other way around. We don't ever want the VA to feel like a patient has come to the DMV. We want to make sure that they're getting the service that they deserve. They're the honored guest, they're the VIP. And so the Secretary has said, we're going to cut all the layers out, and I'm going to hear directly from veterans on a committee. They've been doing that for the last year and a half. He also has an Employee Engagement Council. Now, employee engagement is a score that talks about, do employees really wish, are they plugged in, are they awake at the wheel, are they actually here and motivated to serve veterans? And in many places, that's unfortunately not been true. We want to inspire you to be awake, engaged, realizing your connection to the mission of the VA. And the Secretary of the VA has decided to cut out all the red tape, and he has a group of frontline employees across the system. And he meets with them on a recurring basis, and he says, how's it going? Are we doing well as an employer? Are we meeting your needs? Are we doing what we need to do to make sure that you are supported as a worker in the VA? The VA is also creating partnerships with organizations that we've never partnered with before. While I was in Washington meeting with the Secretary, they brought in the owner of the Boston Red Sox. And I thought, oh, that's kind of cool. We have a guest speaker. He's the owner of the Boston Red Sox. In fact, he would ask questions, and if you answered them, he would like throw an autographed David Ortiz baseball out into the audience to the person that asked the questions. And I thought, well, that's great. What do we have to do with the Boston Red Sox? Why is he here talking to us? Well, it turns out he has a philanthropy organization called Home Base. Get it? He's the owner of the Red Sox, Home Base. But this organization provides adaptive sports equipment to veterans that have returned from conflict. They brought a gentleman there with him that had lost his leg 9 years ago in an IED explosion in Afghanistan. And this guy used to be a competitive runner and hurdler. And they gave him a new adaptive sports leg that was allowing him to return to competitive running and hurdling. And so we watched, I couldn't jump over the hurdle, but he could do a good job doing that. And the partnership between the Boston Red Sox and the VA, these are things the VA didn't used to do. We used to try and live on an island. We provided care to veterans. We didn't partner with the broader community. And the idea is partner with the broader community. And so the VA has been doing that to a greater extent. One of the things that the Secretary is very proud of are these 80 community veteran engagement boards that have been launched across the system. His goal was 100 by the end of the year. You know, the Hawaii VA has a community veteran engagement board. It's going to meet this Friday here, and they're flying in some of the representatives from the outer islands. They're all coming here so that the VA doesn't run the community veteran engagement board. It's not chaired by the director of the hospital. It's actually run by the community. Various veteran groups that are advocating on behalf of veterans, and the VA participates in the board as a member, not running the board, but listening to the community. And so I hope you're getting the theme as far as what's different about the VA is that it's trying to listen to its patient base. More ears than mouth. Actually hearing, what do we need to do better? And so this is some of the things that the VA has been doing. We've cut veteran homelessness nationwide in the last 6 years by 47%. 47% fewer homeless veterans. Now, many people say, you know, every time I see the cardboard sign and the homeless person, it says, God bless, you know, help out, I'm a veteran. And you think every homeless person out there must be a veteran. Well, there is a large portion of homeless veterans, and that's true in Hawaii as well. Do you know, as Hawaii or Pacific Island Healthcare System employees, that we've got 700 vouchers to give subsidized permanent housing to those that are chronically homeless, and that we are making a difference. That there are, even though the homeless population in the United States in the last 6 years is actually higher than it was. So in 2016, when they did the point-in-time inventory, now they do point-in-time once a year. They go out under the bridges to all the homeless camps. They count how many people are homeless at that moment in time. Now they picked January because in the rest of the United States, you have to really be committed to be homeless if you're under the bridge in January when it's lousy weather out. Here, I'm not sure January versus July. It's probably the other way around here, where you got to really be committed in July and not so much in January. But the VA is making a difference. There are fewer homeless veterans in 2016, even though the regular population has seen an increase in homelessness during those 6 years. And really, the VA should be very proud of that. In 2016, the VA completed 4 million more healthcare appointments than it had the year before. 4 million more. That's an incredible number of access, availability. Do you know, here at the Hawaii VA, not only did you do more appointments, but you saw more patients. About 1,200 more patients than the year before. Now up to 35,000 veterans, sometime during the course of last year, got care at the VA. That growth isn't always realized or appreciated. Everyone in the news is saying, boy, there's such a long line, I can't get care at the VA. But the reality is more veterans are choosing to come and to get their health care in the VA than ever have before. In fact, the veteran population is declining. So as World War II veterans and some of the Korean War veterans are dying, they're not being replaced at the same volume with new OIF, OEF, OND returning veterans. The veteran population is shrinking, but the number of veterans that are using the VA is going up. More veterans are choosing to use the VA as opposed to other alternatives. And in fact, we saw 4 million more appointments, 96% of those within 30 days. That whole thing about, 30 days, it's a little misleading. Like if you're a scheduler, you work in clinic and you're thinking, how long does it take if somebody walked up today and said, hey, can I get an appointment for whatever? Or you received a consult and you thought, I don't think 96% of the time I can actually book an appointment within 30 days. It seems like all of the appointments are further than 30 days out when I'm booking the appointment. Well, part of that is the nuance in how it gets measured. So clinically indicated date or preferred date, and it says 30 days from that date. That's not always 30 days from today for every request that you receive. And so when you as a VA employee hear, we do 96% of our appointments within 30 days, our VA doesn't do that. You have to appreciate what are they measuring. But you also need to appreciate that the VA is the only healthcare agency in the United States that publicly shares its wait time data. The only one. There is not a single other healthcare system out there that's publicly sharing this is how long you have to wait for an appointment. And if you, as a private citizen, have appreciated how long do you sometimes have to wait to see that specialist. In fact, some specialists actually can charge more money the longer the wait is. In fact, I met a lady the other day that was thrilled because the orthopedic surgeon that was going to do her hip replacement didn't have any available appointment slots for the next 8 months. And that was a good thing, because they were so popular and such high demand that you had to wait 8 months before you could see that particular provider, before you could get scheduled for your hip surgery at yet a future date. But the VA publicly shares its data every 2 weeks. In fact, it specifies all the way down to the very specific site of care. So every one of our clinics publicly reported, this is how long you have to wait, this is how many patients are on a waiting list, this is how many new patient appointments are being scheduled, and this is the time that it takes from when they ask for the appointment to when it's scheduled. The VA publicly shares that data. You might be surprised to know that if you actually ask, and the VA does ask, veterans, are you satisfied or completely satisfied with the timeliness of your care? So that's a survey question that the VA asks its patients. 90% of the veterans surveyed answered yes, I'm satisfied or I'm completely satisfied with the timeliness of care. Now, to read the newspapers or to watch the news, you'd think it was 90% the other direction, that were not satisfied. But that's not the truth. 90% of veterans answered the question, completely satisfied or satisfied with the timeliness of care. You know, the National Cemetery, by the way, Punch Bowl is beautiful here, a fabulous facility here in Hawaii. I was there on Veterans Day for a ceremony. But the National Cemetery Administration is actually fabulous news for veterans. Only 12% of veterans actually know about their burial benefits in a national cemetery. But if you qualify with an honorable discharge, you can get buried at a national cemetery, and your spouse and your dependent children at no cost. It's a free burial benefit. Veterans don't know that. But those who do and use the National Cemetery Administration, there's a survey called the American Customer Satisfaction Index. It's not run by the VA, it's an outside entity, and it measures customer satisfaction in industries all across the United States. And for 6 years in a row, this year included, the National Cemetery Administration ranked #1 in the country in any industry, best in the nation in customer satisfaction. In fact, this last year and one other year, NCA actually scored a 96 out of 100 on their satisfaction scale. That is the highest satisfaction rating of any industry across the entire United States ever. And NCA twice has set the record for the highest customer satisfaction through that survey. So if you see your NCA counterparts, if you're talking to a veteran and they're talking about their service for the VA, one, tell them about their burial benefit. It's a fantastic benefit that not many veterans are aware of, but #1 in the country, NCA, they're doing a great job. So if you see the employees that are working out there at Punch Bowl, give them a high five because they're doing a great job. What about VBA? You know, I used to do town hall meetings as a director, and I used to love that I worked for the healthcare side because everybody would complain about the benefits side and nobody complained about healthcare. It was all, they took so long to decide my claim and I've had an appeal for X number of years and they never answer the phone when I call them. And so I wouldn't love that my poor VBA counterpart was getting all the grief during the meeting, but it sure felt better to be on the healthcare side because I thought, you know, we must be doing great. Now, when you go to a town hall meeting, people complain about the healthcare side more than they complain about the benefits side. And that actually isn't because we've gotten worse. It's because VBA has gotten better. They've gotten more timely in adjudicating claims. 90% of the claims reduction over 120 days. Their entire inventory of claims that they have to decide is down 57%. They've actually gotten better because they've caught up with VHA and they've automated their process. You know, we had this electronic health record for years, and veterans would come in and they'd update their phone number with us, but VBA was all paper. And you know, the claim, the C file had to go for their exam, and then there's only one file, and so that was a linear process. They've automated their process and they've gotten much faster. And so when veterans today realize, whoa, I just got out of the military, I walked into, and I filed my claim, and 94 days later, I'm now getting my check from VBA. It's phenomenal how much faster it is than it used to be. Now, there's still the individual appeals and claims that people aren't thrilled with, but in general, VBA is doing a tremendous job, faster at adjudicating claims. Their inventory is down, and now VBA is appreciated, and VHA is more in the spotlight when you do these public forums. But VHA is still making a positive impact on veterans. I want to share a few things with you that you might not know about VHA. Besides pioneering the modern electronic medical record, it used to be it was the gold standard. So CPRS, even Vista before it, without the GUI interface, as an electronic record that was integrated, and it had all of your labs, and it had all of your prescriptions, and it had your history, and it had where you went to a different VA and you could get that record, and it was connected to the eligibility and enrollment screen for all the insurance. It was the gold standard, connecting it all together. That was pioneered in the VA. You know that pacemakers was discovered, invented, and deployed in the VA. They didn't have, the VA invented pacemakers, implantable pacemakers. The first successful liver transplant in the world was done in the VA. They didn't do liver transplants before that. The nicotine patch was created by the VA, in the VA, by a VA researcher, the nicotine patch. Genetic risk for schizophrenia, Alzheimer's, Werner syndrome, so many others, identified in the genetic stream in the VA by VA research. So you work delivering care, providing appointments here. You might not appreciate, we have a whole research arm that has been profound in its impact on healthcare far beyond the VA. Institute for Population Health, which is actually run by a gentleman by the name of Ken Kaiser. He's my neighbor where I live in Sacramento. And Ken Kaiser, former Undersecretary for Health for the VA, his foundation did a study on cancer care. And it found that VA patients get superior outcomes than patients that get cancer care outside of the VA. Now, you don't see us marketing ourselves like you know, some of the premier cancer care groups in the United States. But the reality is, if you're going to get cancer and you're going to get care, you're better off if you are getting VA care than if you're in the private sector getting cancer care outside the VA. Data has proved superior outcomes in the VA. our affiliation with medical schools, 7 in 10 people that become doctors in the United States, part of their training is done in a VA facility. If you removed the VA from the landscape of American healthcare, we'd be in big trouble. The entire nation would be in trouble in the training of future healthcare professionals, not just doctors, that's done within the VA system. The Secretary ended his talk, and I've got a couple more PowerPoints we're going to walk through here, by wanting to encourage staff to keep our eyes on the mission of the VA, to remember why we're here, serving those that have served our country. So if every day you come to work, if you're frustrated about IT or contracting or HR or whatever it might be of the day that you're saying, you know what, it's so terrible to work for the government, for the VA. Take a moment to think about the job that you have. You have been given the privilege to serve those that are protecting our freedoms in the United States of America. Even as a healthcare professional, and you may have never thought you're going to end up working for the VA someday, but here you are, you're working for the VA. It's not a for-profit healthcare system. It's not an insurance company that's saying, yeah, we'll do that, but we won't do that. You're working in a fully integrated healthcare system that is serving America's veterans. And by the way, we're doing a great job on the quality of care that we're providing. We're doing a very competitive job on the timeliness of care that we're providing compared to other healthcare systems as well. It's an honor to work for the VA. Let's go ahead and switch to the healthcare focused one. I now have a presentation from the Undersecretary for Health, Dr. David Shulkin. I want to talk about some of the things that have been recent accomplishments. What has the VHA been up to? One of the things the VA does that isn't often appreciated is that we're a responder when there's national disasters. Did you know when they had the nightclub shooting in Orlando, it had nothing to do with the VA, but the VA responded. We sent social workers, mental health professionals, caregivers to respond to the community disaster. Did you know that the VA actually participates in the deployment for emergency management personnel through a program called DEMPS? And when they had flooding in North Carolina recently, the VA sent employees to respond to the national disaster. And whether you're a police officer, you're a social worker, you're an RN, you're a pharmacist, you're an administrator, the VA sometimes needs us to respond. And you can sign up to participate. If your supervisor releases you and you volunteered through the DEMPS program, if there's a national disaster, you can go and respond and give back and help our country in its time of need. The VA has gone to Orlando, to Dallas, to West Virginia, to Louisiana, just to name a few, this year, responding to national disasters. And you have the opportunity to participate in that if you want to as a VA employee. When they have a call, they'll say, we need X number of whatever particular type of profession, and then they circulate who's available to go. My medical center just sent somebody to North Carolina last month to volunteer to help with the national disaster with the flooding that they had there. Many people don't realize that that's part of what VHA does, and as an employee working for the VA, you have an opportunity, if you want to go and respond and participate. The VA sent staff and stood up when Hurricane Katrina hit and some of the big hurricanes. These federal sort of tent cities, transitional housing with health care, and you could go and volunteer for weeks at a time if you want. We're also participating on still making a difference in research. So I talked about the pacemaker and the nicotine patch and some of the liver transplants and the things that were inventions in the VA. But the VA is currently doing the Million Veteran Program. And veterans are volunteering to participate in this long-term research study where they're pulling the genetic DNA of the veteran. And then they're watching the lifetime of that veteran. Which of those veterans ended up with colon cancer? Which ones end up with COPD? And are there genetic risk factors that have been connected with what's happened in that veteran's health care in the life of them in the study and their genetics and their DNA that they have voluntarily participated and given to the VA? 500,000 veterans have already signed up and are participating in the Million Veteran Program. Find another healthcare system that can actually impact the future of healthcare, customized healthcare, genetic-specific risk factors. What are the predictions? What are the treatments that actually work better on certain portions of the population? This is the future of healthcare, and the VA is leading the way in the United States. 500,000 veterans signed up in this long-term Million Veteran Program study. I'm not sure if the Hawaii VA has the ability for veterans to volunteer and sign up. We'll have to ask Dr. Ross if we have any participants.
You can ask me.
Oh, you're right here.
I am.
Yeah, are we participating? in the
We are
Million
not
Veteran
yet. We
Program?
have applied for it, but we've not been accepted yet.
We're working on it.
We are hoping.
Okay.
Yes.
That's right. You work in research. I remember. You're all the committee coordinator. That's and you do the newsletter.
That's it.
The quality newsletter. All right. I mentioned the study from Dr. Kaiser's group from IPHI about cancer